Hi, and welcome to our podcast today. I'm Kate Rose, your host for 21st Century Healthcare Consultants Home Care Today. I'm here talking with Teresa Harbour, who's a wonderful guest to have on our show. We're grateful that she's here. We're going to be talking about the importance and the magnitude of accreditation in the home healthcare industry. It's a slippery watermelon at times, I believe, and we've talked about how the regulations are changing. People need to know what's new, what's not working anymore, and how to go about addressing the changes. Accreditation is important for anybody who's looking to deal with insurance companies and the like, so let me get on with it and introduce Teresa. Thanks for being here. Teresa is the Chief Operating Officer at CHAP, one of the three major accrediting agencies that we have in the industry. Teresa, tell me what CHAP stands for.
Community Health Accreditation Partner.
Community Health Accreditation Partner.
Yes.
All right. And tell me a little bit about the difference between your group at CHAP and the other agencies, the accrediting agencies that are out there today.
All right. Well, CHAP was the first accreditor for home and community-based organizations. We started back in 1965 as a joint venture between the American Public Health Association and the National League for Nursing. So they identified, there's really no accrediting organization that focused on home health and hospice organizations. So that's how we came about. So some of the bigger differences, and probably the biggest difference is that we only focus on home and community-based organizations. So any initiatives that we are looking at is really focused on how to deliver better care in the home. Where our competitors, they also accredit hospitals, and that tends to be where their focus lies. Our standards are written to be very broad, allowing organizations to demonstrate to us how they meet the intent of the standards versus us telling them how to deliver care. And of course, our standards include the Medicare conditions of participation. So you have that regulation to make sure you are adhering to, but then you can demonstrate how you actually implement those particular standards in regards to that. We also have we have accreditation specialists, which most accrediting organizations do. But
can you tell me a little bit about what that accreditation specialist does?
Okay, so they are the person that is really your go-to person for questions regarding change in demographics, or I need to add a location, or we just have moved, or we have a change in administrators. So that's typically what the accreditation specialist assists with. But the great thing about CHAP is that we also have directors of accreditation that are master's prepared clinicians that have been in our industry for many, many years, have been in management positions, administrative type positions with organizations, so they are very aware of what's going on in our industry, both at the national level but at the state level, because they're assigned particular states to assist organizations throughout the process. So a great resource. But probably the biggest difference, I've said that several times, but one of the biggest differences and why we work so well with startup organizations is that our time to survey is very quick. And that is super important for a startup organization because, really time is money for them because, they're providing free care until they get their Medicare certification. So when you're looking at when an agency says they're ready for survey until we arrive on site, our average last year for hospices was 18.03 calendar days. For home health, it was 22.02.
How does that compare?
So what I hear from our competitors is that they're out within 60 days. So every day that they're waiting, they're providing that free care until somebody arrives on site to do their Medicare certification survey.
And talk just a minute about what that survey entails.
Okay, so it's all encompassing. So we look at all the way from patient care up to the governing body. With CHAP, our focus is very much on patient care. Our standards start with patient care. Our surveys, focus on patient care. We do, back into policies. If we are seeing maybe a plan of care not being followed, then we'll ask to see what your policy is on that. But we're not a policy surveyor. But we do look at, patient records. We make home visits to ensure quality care is being delivered. We look at personnel files to make sure, the staff is competent, well-trained, that they've been oriented, have in services, those type of things. And then we look at emergency preparedness, infection control, complaints, really everything that the organization is doing, we review.
And so when a company, an agency is getting ready for their survey, what's that like for them? What is your observation in terms of their demeanor, their state of mind? Are they nervous? Are they anxious? Are there certain problems that a lot of new agencies face that you all are anticipating and ready to help them with?
All of the above. They are nervous because, like I said, they have a lot riding on this. A lot of these agencies that are startup agencies, we work with a lot of very large companies that are starting a home health or hospice, and they have, a lot of corporate support available to them. But we also work with a lot of single site locations to where these individuals have taken, second mortgages out on their homes to start their company. And, they are nervous because, they've got a lot invested in both time and money. So they're very nervous about the survey, that they really want us out there quickly. But for a startup, they're excited to see us because they know that this is getting them closer to their Medicare certification. One of the things that I see with agencies that are starting up, that I always encourage agencies, and 21st Century does a great job in really educating their agencies and preparing them for survey and just to be fully operational. But we tell agencies all the time, know the regulations, know the Medicare conditions of participation. Read your policies, know your policies, be familiar with our standards, and our standards incorporate the Medicare conditions of participation. The biggest struggles, though, that we see is, limited resources. So you'll have, the administrator, also the director of nursing, also making, visits, and then you'll have, a backup administrator, backup director of nursing, backup nurse. But they're limited people, so they're wearing a lot of hats, and it's a lot of work on them. So just having the time to be able to, really implement the regulations, the requirements, the standards, deliver great care with a limited budget. That's a struggle, and so I tell agencies all the time, focus on patient care. That's where our focus is going to be, that you're delivering that high quality care.
Are the surveys one and done in the beginning of an agency's life? That's when they have their survey, they're accredited, and then assuming that there's no violations down the line, it should be fairly smooth sailing for them if they're prepared and they have support such as from CHAP?
Absolutely. So, we do in some states a licensure survey. So we'll come out, make sure they're meeting the state requirements, follow up with the state issues their license, they start taking patients, and then we do their accreditation survey. So some of those organizations will see us twice. But typically with organizations, either a startup or an established organization, we go out, ensure that they're providing high quality care, meeting the intent of our standards, following the COPs, and they are accredited for 3 years.
Okay.
And so that lasts for 3 years, and then they go through the process again.
So in 3 years they'll go through another survey process?
They will, yes, absolutely.
And that's true for the life of the agency?
Correct. And that's a requirement from CMS that agencies are surveyed every 36 months. And so our window for survey is anywhere between 32 and 36 months.
What are the minimum requirements for being able to pass a survey?
Well,
just in a nutshell.
Yes. Well, the biggest thing is, that quality of care and being able to demonstrate that you are adhering to those conditions of participation and providing quality care. That's the biggest. That sounds easy, but it's not.
I was just going to say, so what is a way that an agency would go about demonstrating that?
Okay. So we will look in patient records. And we'll look at how the care has been documented. We'll look at the assessment, make sure it addressed the patient's needs. We'll look at the plan of care. Any identified, problems or concerns in the assessment should be flowing to the plan of care. And then staff should be following the plan of care. And, that sounds all well and good and very simple, but, patients are all different. And, what we typically see, or sometimes see, I should say, agencies are not making the plan of care individualized. So if I'm looking at 5 records, all 5 records may very much read the same in that the patients have the same interventions, the same goals, and it's truly not individualized. So that is our number one deficiency, is individualized plans of care. Because in healthcare, the only way to really move the needle in the direction of where the patient needs to go and have those improved outcomes is to have that patient involvement and focus on the needs of the patient. And once again, that's easier said than done.
Right. And like you said, everybody's different.
Yes.
And not just people, but all of the circumstances surrounding
Yes.
them, the extenuating circumstances, not just their conditions, but family,
Right.
resources, intent for the future, and so on and so forth.
Right.
So if you were to give some casual advice, what would you say to an agency that's just getting started, getting ready to prepare for their survey? You've talked about how important it is to deal with the plan of care and make sure that it's individualized so that the care, the quality of the care is there for each individual person. So is that the top piece of advice that you would give, or would you be able to expand on that and offer more counsel?
Yes, so I would definitely say, that is their focus, is on, the patient assessment, the plan of care, and following the plan of care. That's the biggest area of focus. Really looking at that patient record and having leadership there in the organization make some home visits with the staff. See what type of care is being delivered. One of the things that we started offering last year is age-friendly care at home certification. That was a grant that we got from the Johnny Harford Foundation. We worked with them, the Institute for Healthcare Improvement, IHI, the American Hospital Association, and then national leaders of our home care and hospice organizations to really look to see how we could bring age-friendly health systems to the home setting. So when you talk about individualized care, that completely provides that individualized care because you're focusing on what matters to that patient. And so it's all built around this framework of 4 M's: what matters, medications, mentation, and mobility. And so this is all evidence-based, and when you provide this care, health systems have seen improved patient outcomes, improved patient satisfaction, and improved staff satisfaction. So when you're looking at how to individualize care, focus on what matters to the patient, and everything else will fall into place. So that is, a big, portion of what we see around the plan of care. We see other deficiencies, and this is surprising with COVID, but infection control. We still see a lot of agencies getting cited for not following their hand hygiene practices or not following their bag technique practices. So when I say, make a visit with your staff, just see what they do in the home. Are they following, your policies around that? So, those are some of the big things that we see. Medication reviews. And I tell this every time I talk to agencies, and at boot camp, yesterday I brought this up as well, because I'm the same way. When I go into a doctor's office and they ask me, have you had any medication changes since the last visit? I've had changes, but I always say no. Because it's so much easier to do, is just to say no, unless I know it's something really big I do need to tell them about. But I say no. Well, when we go into patients' homes, they often tell us the same thing. Have you had any changes in your medicine since the last visit? And they'll say no, knowing they went to the doctor just a couple of days ago. And
there's a good chance there might have been a change.
Exactly. Instead of just, so instead of asking, do you have any changes, say, show me your medication changes since your last visit, or since my last visit, or let's look at your medication changes. Just kind of changing the question a little bit. But medication reviews are in our top 10 deficiencies.
Interesting. It sounds like just being alert and being common sense oriented in a lot of these situations would help eliminate some of the problems. But it's also a learning curve for people, especially people that are starting their agency for the first time. And to be able to have someone like CHAP to be able to walk them through the process, help them to prepare for the surveys, and then to help with any deficiencies later on down the road. How do you talk to somebody who perhaps didn't do well on their survey, their first one, and they're maybe battling a little bit of discouragement or concern about, because like you said, there's a lot on the line. Financially, resources are thin at that point. You're trying to, make it until you make it. So how do you counsel someone who's maybe not done well on their survey?
Well, the good thing is they'll have their summary of findings, so they'll know the areas that they need to improve on. We help them with their plan of correction to make sure that they know how to make those corrections and ensure that if we have to make another on-site visit, that they won't be cited for the same things. But their director of accreditation is just a valuable resource to them, and they answer questions all the time. And I know that they probably get a little irritated with me because I always tell agencies, call your director of accreditation. That's what they're there to do, is to support you not only through the survey and after the survey, but for that 3-year accreditation cycle. We are here as a resource to them.
So you're there all during that time?
Yes, absolutely.
And if there's not a problem, is there any other reason why they might contact you during that 3-year cycle to take advantage of the wealth of information, the resources that are available to them through CHAP?
Well, we do have a lot of education that we provide through our Center for Excellence, and if they're a CHAP accredited organization or actually a 21st Century consulting agency, they get those same discounts as well. But having that education that's available to them, but then just if there's a change in regulations, if CMS makes adjustments to standards, if there's we had the Appendix M changes with hospice last year, they need to know what those changes are and how that's going to impact their agency. So we do a lot of webinars and provide educational events for them to hear that, but they also are able to reach out to their director of accreditation and get those questions answered as well.
Is there a flow of information from CHAP to your agencies that you provide the accreditation services for?
Yes, there is. So their accreditation specialists, often will send out information. We constantly are sending out email updates, making them aware of what's going on and what changes that could impact them.
So if there's a legislative change afoot, then CHAP is going to take the initiative
Correct.
to communicate that information to your agencies.
Absolutely.
So
yes.
the agencies are able to continue to do what they're doing and trust that you all have got your ear to the ground on their behalf.
Absolutely. And Dr. Jennifer Kennedy, she is our VP of Quality and Standards in Compliance at CHAP, and she had been with NHPCO, or the National the National Hospice and Palliative Care Organization, for many, many years prior to coming to CHAP, and so she is always very much in tune to any type of regulatory changes or updates.
All right, in the last couple of minutes that we have, let me ask you this. And thank you so much for being here, by
Absolutely.
the way. It's wonderful to see you again.
Yes.
What do you find most meaningful for you personally in the work that you do with CHAP?
Well, I'm going to tell you, and I always kind of make this joke, when my daughter was younger, she used to say, "Mama, when you used to be a nurse." Well, I'm always a nurse. But with CHAP, the great thing is, instead of being a bedside nurse and impacting one patient at a time, I get to impact care across the nation. And I take great pride, and I love that, because the difference that CHAP is making to organizations all the way down to patient care. And this is something that we was talking about earlier. Is going to benefit me one day. It's going to benefit you one day.
Right.
And so I love that most about CHAP.
Right. So you have a broad spectrum impact.
Yes.
And it's relative to not just something theoretical, but on a very practical level.
Absolutely.
Is there anything else that you want to let folks know before we wrap up today? You feel like we've covered the waterfront?
I think we have. Just to make people aware that we're here to support you. And I think once again 21st Century is great to work with, because I think we both ensure that the agencies that we work with have that foundation to build upon to be successful.
Well, and ultimately, at the end of the day, that's what everybody wants, because it's not just bottom line. It's
Correct.
really affecting people's lives.
Absolutely.
It's affecting families. It's affecting people's futures, not just those who have the agencies, but people who are being cared for by the agencies. So,
Absolutely.
And with all of the changes in the medical world today, being able to establish and maintain productive, safe, and viable home care agencies is a wonderful alternative to some of the, I'm going to say, less comforting environments that patients can be found in depending on
Absolutely.
their situation. So nothing wrong with big hospitals. We love them. We appreciate them. but there's times when things need to be done on a different front. And we appreciate the work that CHAP does in order to facilitate and maintain a good balance for our agencies out there. Teresa, thank you so much for being with us today. It's been informative for me. I appreciate the opportunity to see you again and to learn more about how CHAP is influencing and impacting the healthcare community. Thanks for joining us. I hope that this has been information that's helpful to you. If you have any questions or concerns, please feel free to reach out to 21st Century Healthcare Consultants. And this has been our podcast to you, Home Care Today. I'm Kate Rose. Take good care.